Bismillah Rahman Rahim. Welcome back to the channel. Today we are diving into an important topic, cirrhosis and how it relates to fasting during Ramadan. Many people with liver disease wonder whether fasting is safe for them, what precautions they should take, and how to manage their health during this holy month. In this video, we shall explore the medical aspects of cirrhosis, the potential risks of fasting, and expert recommendations to help those affected make informed decisions. Stay tuned for valuable insights. As said in the intro, from today we are formally starting our discussion on the workshop. In today's video, I shall introduce you this workshop and we will see what background is there to embark on this workshop. In the first video, I shared with you the workshop overview that it contains 5 sections. We are in the first formal section of this workshop, titled Introduction and Background to the Workshop of Liver Cirrhosis in Ramadan. And this has got 3 main domains or areas to be discussed: the definition of liver cirrhosis, prevalence of liver cirrhosis, and Ramadan fasting and health. It's just the recall of our basics, the definition of liver cirrhosis. Cirrhosis may be defined as progressive scarring of the liver due to chronic liver injury, leading to impaired liver function. And we know because of the different etiologies, the normal liver, which has got no fibrosis, it starts changing into a fibrotic liver with F1 fibrosis, F2 fibrosis, F3 fibrosis, and ultimately F4 fibrosis. And the regenerative nodules plus the F4 fibrosis is equal to liver cirrhosis. The scarring is often the result of chronic inflammation, which can be caused by a variety of factors. Just to recall, these factors are viral hepatitis B, viral hepatitis C, viral hepatitis D, and immunocompromised people, viral hepatitis E. Then fatty liver disease or metabolic dysfunction associated steatotic liver disease. And this is going to replace all the other etiologies of liver cirrhosis in the coming years. Then autoimmune hepatitis, it can lead to liver cirrhosis. Alcohol consumption, this is one of the major causes of the liver cirrhosis worldwide. Then metabolic or genetic disorders like Wilson disease and hemochromatosis. There's irreversible architectural changes and compromised liver function. So we see two main changes in the liver. One is its architectural impairment, and that is irreversible. And second is the liver functions gets compromised. There are two stages of liver cirrhosis. One is the compensated cirrhosis. When liver retains the essential functions, patients may be asymptomatic in this stage. And then decompensated cirrhosis, when we see clinically jaundice, ascites, hepatic encephalopathy, variceal bleeding, and it is associated with increased morbidity and mortality. The mean survival in the compensated cirrhosis is around 10 to 12 years, and in the decompensated cirrhosis, it is reduced to 2 years or less. There are physiological changes in cirrhosis, and what are those changes? There's reduced glycogen storage, and there's impaired gluconeogenesis. And of course, there's the risk of hypoglycemia, malnutrition, and dehydration. So because of these physiological changes in the cirrhosis, when the cirrhotic patient fasts, it gives rise to challenges, or it brings the challenges, and these challenges are reduced glycogen storage, impaired gluconeogenesis, so the risk of hypoglycemia, malnutrition, and dehydration is increased. What is the prevalence of liver cirrhosis? As refer to the recently published article in 2023, it's a review article entitled The Global Epidemiology of Cirrhosis, Etiology, Trends, and Predictions. And I'll suggest that when free, you do go through this article. This is a beautiful article, the latest article, and it gives you the overview. It reviews the data, the global data regarding the epidemiology, its etiology, what are the trends, and what are the predictions for the coming years. So in the Global Burden Disease Study 2017, which this article refers, and the worldwide there are 112 million people affected with cirrhosis. So in the world, 112 million people, they are affected with cirrhosis. And this comes 1,395 cases per 100,000 population. So it's a very common disease. There are 1.5 million deaths of cirrhotics per year in the world. The prevalence of liver cirrhosis varies widely depending on the region, with the highest rates found in Africa and Asia. This study, it summarizes the etiology of cirrhosis from 1993 to 2021. And this figure from this review article I'm sharing with you, it has divided the world into different regions where the predominant cause of etiology, what is the red, it shows the alcohol. These countries, they are the commonest cause of the liver cirrhosis is alcohol, those areas which are highlighted in the red color. Then comes the hepatitis B, the China, the India, and all these. So these are the areas where the commonest cause is hepatitis B. Then comes the yellow, the hepatitis C. These are the areas where hepatitis C related liver cirrhosis is the most common cause or the most common. And Pakistan is here. In Pakistan, when a patient is found to be cirrhotic patient, this is hepatitis C unless proven otherwise. And the data not available, these are the gray areas. So the globally, the commonest cause is the liver of liver cirrhosis is the alcohol, then the hepatitis C, the yellow, then the hepatitis B. So these are the most common causes. And as I told you, in the coming years, probably the whole colors, they will be changed to another color that will be the fatty liver disease. But this is the data from 1993 to 2021. So the predictions is, and what is the going to be the future, probably this will be the muscle metabolic dysfunction associated steatotic liver disease. Previously, we are calling this fatty liver disease or NAFLD, non-alcoholic fatty liver disease. Then again, this MAPE, the same MAPE, this was regarding the dominant reported etiology of cirrhosis from 1993 to 2021. And this, now the color here, it tells estimated age standardized death rates due to cirrhosis in 2029 by country. Again, the world has been divided into different colors. The lightest color is where it is less than 10 per 100,000 population, then 10 to 20, then 20 to 30, then it's the 30 to 40 in Pakistan is in this region, then the 40 to 50 and above 50. So the whole world has been divided into different, and in Pakistan, this is the risky country with the risk of the liver cirrhosis. It's very high over here. And I remember a decade or 15 years ago, an article was published in Lancet and stating that Pakistan has become the cirrhotic liver country. So liver cirrhosis is one of the commonest causes here in Pakistan. So this is another study, the global, regional, and national burden of cirrhosis by cause in 195 countries and territories from 1990 to 2021, a systematic analysis of the global burden disease. This is that study which the previous study was giving reference, and this was published in 2020. And according to this again, the prevalence of compensated cirrhosis per 100,000 population, this is the prevalence. And again, they have divided the world into different colors. So the Pakistan is lying over here, where the prevalence of compensated cirrhosis per 100,000 population is 500 to 750. So the darkest color is where it is 290 to 500. These, then the second comes 500 to 750. These then becomes the 750 to 1000. These then becomes the 1000 to 1250. So in Pakistan, the prevalence of compensated cirrhosis per 100,000 is from 500 to 750. And this is the prevalence of decompensated cirrhosis. Previously was the compensated cirrhosis. And this is the decompensated cirrhosis. And this is the 40 to 75. This is the prevalence. That's 40 to 75 cases per 100,000 population here in Pakistan. So the Pakistan, the liver cirrhosis is the common finding, and what we see, the decompensated cirrhosis is common over here as well. Again, death rate in cirrhosis per 100,000 population, according to that Global Burden Disease Study 2017. This is the Pakistan. Here it is 3 to 9 cases per 100,000 population. They die because of the liver cirrhosis. So, with recalling the basics of the liver cirrhosis and the prevalence of the liver cirrhosis in the world and in Pakistan, the Ramadan fasting and health is a fundamental aspect. We know Ramadan is the fundamental aspect of our Islamic practice, where we Muslims fast from dawn to sunset for 29 to 30 days, depending upon the lunar month. While fasting can have spiritual and health benefits, it can also pose risks for individuals with chronic medical conditions, including liver cirrhosis. And that's the reason we have started this workshop. In the next episode, we shall discuss the physiological changes during fasting. That in the normal person, what are the normal physiological changes? And after this, we will compare that with the cirrhotic patient. That how the cirrhotic patients has those challenges or those issues, and then we will proceed how to uh, treat these patients. Uh, Please, what do you want to be discussed in the next episode? Do share in the comments section below, and I will try to include those queries in my next vlog as well. The reason is that uh, I want to enable the my colleagues, my juniors, medical students, the postgraduate students, the general practitioners, family physicians, the young doctors, that they should be able to decide on the spot that if their patient is cirrhotic, what to decide about them, how to decide about them, and what the data is suggesting. Because when you want to ask someone not to fast or to fast, it should be data based, because this is the Islamic fundamental uh, part of our Islam. And so, if you want someone not to fast, or if you want someone to fast, you should be having a concrete and solid data at the back of your advice. And this workshop is for that purpose, to enable you to be using that data for making any decisions for your patients. So, see you in tomorrow's vlog on the physiological changes during fasting. Please do watch this, and if you have got any uh, suggestions, any comments, please share those in the comment section below, and I'll try to include those points in tomorrow's vlog as well. So take care. Khuda Hafiz.